killing Haitians. Joining me from Washington, Annie Foster. She is Associate Vice President for Humanitarian Response for Save the Children. Annie, good to see you. Look, I've been talking to our medical folks, and they are suggesting to me that we shouldn't be here right now, better than 9 months into this disaster, that if we were going to see a cholera outbreak, it should have happened earlier, and that 9 months in, we should have the filtration systems in place. We should be trucking in the water in the areas where the filtration systems aren't in place, but that we shouldn't be seeing a cholera outbreak at this point. What are your thoughts on that?
Well, it is unusual 9 months later, but you know, cholera hasn't been in Haiti for over 50 years, so it is quite an unusual occurrence. But you know, whenever Save the Children hits the ground after one of these emergencies, one of our major priorities is water and sanitation. When you have overcrowding like that, limited access to clean water, very limited health care, and no latrines or sanitation, then the risk of diarrheal disease is going to grow. And the children are the ones that are going to be the most vulnerable, obviously.
Well, Annie, what's the problem here? I mean, again, we're talking about better than 9 months into this. Again, it's the same question. Why are we talking about a cholera outbreak?
Right. Well, Haiti was a very, very poor country to begin with very little infrastructure. And this earthquake hit the capital city, and the infrastructure was basically gutted. So that puts things at risk and puts diarrheal disease at a greater possibility. But you know, the other thing that we're looking at is the specific vulnerabilities to small kids.
Yes.
So breastfeeding is very important, exclusive breastfeeding for those infants 6 months and under. When I was in Haiti, I met a mother who had twins, a month or two old, right when the earthquake happened. When the earthquake happened, she grabbed them both. She dropped one, and one of her babies perished. She had another one. The other one survived, but she was so traumatized, she said her milk dried up. But she came to a Save the Children program tent. We had tents all over the place. And through counseling and education, she was able to start breastfeeding again, and her kid was safe. She was taught about the dangers of contaminated water for her very small children.
So Annie, I know it sounds like a one-note, one-question interview, but look, after this earthquake, the world flooded Haiti with aid, with assistance, with water. So again, we are better than 9 months into this. We're talking about a cholera outbreak. What's the problem here? Is it an NGO problem? Is it an NGO coordination problem? Is it a government problem?
Well, I think the key here is for hygiene education. We've got 1 million people still living in camps in Port-au-Prince. They need to understand, as Sean Penn was saying earlier, what kind of water they need to provide for their kids. What's the difference between clean water and river water? We need to provide sanitation services for them so that we have water, latrines, and hygiene education. Those are the 3 pillars that are going to help control this issue. So
the NGOs have to be responsible for doing that, and the government has to be responsible for doing that, correct?
Absolutely. It's a partnership. And right now we're working with the government to make clinics open and available 24 hours a day. We're bringing in 15,000 bars of soap to distribute to schools throughout Port-au-Prince. We're doing hygiene education. We're setting up cholera centers. So together with the government and NGOs like Save the Children, I think it'll get better.
Okay, Annie, appreciate it. Thanks for your time. The bottom line on all of this is that Haiti still needs your help. Just go to CNN.com/impact to find out how you can do your part.